I'll turn now to introducing our next speaker who spoke on the very first day on the first panel of our conference. We have Dedorah Daro here, who's an associate professor and research fellow at the Chaplain Hall Center for Children at the University of Chicago. Prior to joining Chaplain Hall, she served as the director of the National Center on Child Abuse Prevention Research, a program of the National Committee to Prevent Child Abuse, where she contributed to the development of the Healthy Families America program, a strategy for developing a universal system of support for all newborns and their parents. With over 20 years of experience in evaluating child abuse treatment and prevention programs and child welfare reform efforts, she has directed some of the largest multi-site program evaluations completed in the field. So thanks very much, Dedorah.
I want to begin by thanking people for being flexible and understanding with my travel plans. I thought I understood traffic. I come from a big city with lots of cars. São Paulo is in a different level of traffic, and I learned that after I arrived. I'm going to be underscoring a number of the points that Susan already raised, particularly the importance of understanding that sustainability takes time and it requires work on multiple levels. Let's see what we're doing here. My main points that I want you to consider is that sustainable, high-quality programs require an emphasis on both program fidelity and infrastructure development. It's important when we think of program fidelity to manage the inevitable need to take whatever program you're doing and that you're happy with and begin to adapt it to the changing populations and environmental contexts you're most certainly going to face. It reinforces many of the points Mark made yesterday. And more importantly, I think long-term program sustainability requires development of an infrastructure that reflects program principles across all domains and provides sufficient fiscal resources and human capital to sustain your efforts. What do I mean by across all domains? When I think of programs, in the middle is your home visiting program. But that program rests within an organization that delivers the model, that rests within a local community or service network, that is rested within a state system or a national government. We need to have principles that reinforce the home visitation program at every level of this model. When people talk about sustainability, I'm sorry, my eyes are at a very bad point here, you know. I don't know why, my eyes just stopped functioning at some point. That some people will argue that successful sustainability rests in ensuring that your program is as strong as it can be, that it can resist whatever the system will throw its way. The other model of sustainability says programs are never going to be perfect, so we need to have an infrastructure or a context that will help those programs survive and support high quality and consistent service delivery. In practice, of course, we need both, and that's what I want to focus on today. Think of an analogy that you have a plant, and you've grown your plant inside the house, and it's a wonderful plant. You take your plant and you put it in the backyard. And when you plant it, you sort of plant it someplace where there's no sunshine. Number two, the soil the plant is in isn't very good soil. It's rocky, doesn't have any nurturing. Problem number two. And then you forget to water the plant. Problem number three. And then the plant dies. So, is it the plant's fault that it died? Was it not a strong enough, hardy plant? Or did you, as the gardener, fail to care and nurture the plant? It is the same thing with programs. We develop a lot of good programs, and then we place them in a context that simply can't support it. So when we think of sustainability, I'm going to talk first about how to make the plant as strong as it can be, and then secondly, how to improve the soil. So with respect to models, oops, wrong. The struggle we have with programs is we want to maximize population level change, and to do that, we need to have an intervention in many places and sustained over time. We need to extend the program's reach so that it's working with lots of different elements of the target population. But if we don't do this adjustment well, as Mark talked about yesterday, we can reduce our program impacts. So what are the characteristics when we talk about fidelity in our work? And John mentioned this morning. We think of both structural aspects, things like engaging the right population, providing services for the right period of time, caseloads, staff training and supervision, and the content of what you deliver. But we also talk about what we've termed dynamic aspects. And this is the manner in which services are provided and the way in which you transmit core values. Often we focus too much on the structural and not enough on the dynamic aspects. Barriers to high-quality implementation really include a poor organizational structure that can't provide the staff the support they need, a lack of specific guidelines regarding innovation or model adaptation, and something we've come to call in our work at Chapin Hall gravitational pull. I think you heard it from the presentation in Chile. You can train people, but they will go back to doing what they're comfortable doing. Gravitation just pulls them back to where they are. And it's very difficult to break that cycle, even with a well-specified program. The things you can do to improve replication is to pick the organizations that you're going to implement your site in very carefully, to have strong guidelines and compliance indicators, to provide strong training before the program starts, and then ongoing supervision and support that will monitor those dynamic aspects, those critical aspects about how services are delivered. And I think this is facilitated by a time management system, data collection, that's very sensitive. So the worker completes a form or documents an event, and that information is fed back to the worker in a short period of time. When I think of this schematically, it's you have the factors supporting implementation and innovation under the program. The barriers are making it more difficult, but both of these are filtered through an organizational culture that talks about careful planning, staff training, and supervision, and the efficient use of data. When you have this aligned, then I think you have programs that can be sustained that will indeed enhance outcomes. So it's not just starting with a strong program, but it's putting the program in an organizational context and setting that will reinforce those positive aspects of programs you know you need to sustain effects. In our work in home visitation implementation in the United States, we really have come to believe to underscore the importance of fidelity to a model. And by that, I don't mean just that you're a high-cost, very sophisticated, one of the identified evidence-based good programs. It's really any program that you have taken time to develop you believe you have good reason to understand that it's going to work, that program also needs to be implemented in a way that's reflective of the principles you believe make that program work. We've learned that it's about careful assessment of family needs. We've learned that it's about collaboration and establishing with your partners a common vision. We've learned that it's about careful workforce development and having a pool of professionals, paraprofessionals, direct service providers that can deliver your program as intended. And to underscore what Susan said, it's about the importance of evaluation and understanding continuous monitoring of your practice. So that's the program part of it. What would a high-quality infrastructure look like? Well, I think organizations that do well in supporting high-quality programs are those organizations that have a clear mission and purpose as to why they exist. They're organizations that encourage information not just from the top down, but from the bottom up. They listen to their families, they listen to their staff, they create what we often call learning communities. We all know we have part of the puzzle. We bring our part of the puzzle to the table, and together we solve the problem. Organizations that build in choice, so that workers have guidelines they follow, but they also know that they have some flexibility to address the needs of families in the way in which will be most respectful to where the family is at. This also produces an ownership of the program, so the staff don't feel like they're simply employed. It's their job. They come to believe they're part of the solution. They own the program as much as a developer or a designer does. And then I think organizations that are successful really integrate new information. They're going to be organizations that are going to be looking for the strongest research, the newest findings, and bringing those back to their providers. At the community level, you all, I'm sure, work with community systems, other providers in the areas in which you implement your program. I think networks work well when they have a clear purpose and scope, when they have an accurate knowledge of the community's formal and informal resources. Sometimes we think it's about formal programs, but it's not always about formal programs. Equally important is the way in which communities nurture and support their members. It's about having vertical and horizontal diversity in membership. Your collaborations are not just the heads of the agencies. Your collaborations include the heads of the agencies, the direct service providers, supervisors, every level. There's a place in which people can come together and have a meaningful role in building the program. Good collaborations have strong leaders that understand the objective is not for them to get what they want, but for the coalition to accomplish its collective mission. And then, of course, you need to have clear and open communication, both within your coalition as well as external to other community members and national leaders. National systems work with many of the same characteristics. There's cross-agency agreement. As we talk about these programs, looking at a variety of problems and issues, so we want early intervention to both support early childhood development. We also want them to prevent violence. We want them to have children at school ready to learn. Those are very different institutions in most countries. We need to create a common vision across those institutions. We need to have diverse funding streams that people can draw on from these diverse institutions. We need to think of building reforms like in stages. I don't know if you have Legos here, if that's a concept, children's toys, Legos. And Legos always have something to hook on. You know, do you watch a kid put Legos together? There are all these pieces sticking out. And that's what our reform needs to do, to have something that somebody can latch onto when they get a good idea. So your reform can't be just within your agency, but think about what can I reach out to other agencies where we can work on something together. One strategy to do that is sometimes with data, information. Agencies collect common information about who they're serving and what they're doing with them. And I think we also need to remember, and national governments often forget, that all service is local. Families don't get services from the national office. They get services from community organizations. So we need to have that, again, that same sense of ownership and pride that may exist at some national entity into the local service delivery. Now, all of these elements, when we talk about them having a common vision, we're talking again about conceptual clarity. People know where they're going and how they're going to get there. They seek a diversity of perspectives. They realize it's not one person that has the answer, but lots of different people have part of the answer. They encourage ownership of new ideas. We talked about copywriting. That's a pretty selfish concept when you think about it. It says, this is my knowledge, I own it. That's not how you build a learning community. You share knowledge and information. We need to value collective action and share resources in ways that build our interdependency, not our individuality. And we need to use information to understand how we're doing now, but more importantly, to plan for the future and where we want to go. Infrastructure development can be many things. Generally, it consists of good planning, and I'll talk about planning in a minute. Good collaborative capacity around operations, around funding, around communication, workforce development issues, generating community and political support for the ideas we know will indeed protect children and prevent violence. And then finally, a deep appreciation for the role that evaluation can play in advancing our science and our practice. So, we have a strong program embedded in a strong organization, surrounded by strong infrastructure elements. What keeps programs sustainable the long haul? And I think that is largely planning. What do I mean by planning? Planning is the process. When my master's degree is in planning, city planning. And we were always told planning is about putting frames around worries. And we would say, if you can frame it, you can study it. If you can study it, you can solve it. And that's what planning is all about. It's simply saying, what do we want to accomplish, and what's our plan for getting there? When I think of strengthening home visitation program administration, I think about putting your model programs in organizations that can support them, to have clear implementation guidelines and compliance indicators, to facilitate the provision of a strong and ongoing training and supervision program so that workers are not left to do this work alone, but can have guidance in how to proceed. It's providing local service providers with the tools they need to monitor their work and teaching them how to use information to improve practice. And it is about building collaboration, as I said yesterday morning. It is not about going alone. It's about finding who your friends are and who your supporters are and working with them. When I think of building a strong infrastructure, I think of gathering a clear vision and shared goals and expectations across all the agencies and entities you're working with. I think about being clear on some big dimensions, the time horizon. When do you want to see change? Your tolerance for innovation and new practice. Do you have to be sure you're going to get the success, or are you willing to risk something in order to perhaps create new knowledge? It's about being clear about your scope of your target population and geographic area. It's determining the balance you want to make between investing in the plants and investing in the soil. You have to do both, but how much are you going to just replicate programs without making sure you're putting them in communities and contexts in which they can succeed? And then I think you have to establish benchmarks and develop a system to monitor your progress towards the key outcomes you say you want to achieve. Home visitation is going to work only if it's part of a broader system of support for new parents. Equally important to home visiting is having early access to basic care and reproductive health. I believe a universal risk assessment or a touch is essential if we're going to move families, all families, all populations, to a new realization of the goals we want. And then finally, to link what we do with infants and newborns and their parents into our child care and early education system, so that indeed we're building an effective bridge to school. I just want to close. You know I like quotes. I had a couple last time. I have another one. And this is about a commentary that was made after the Nurse Family Partnership published one of its articles. And Felton Earls, who is from Harvard, said, policy considerations should place nurse home visitation within the larger context of the social integrity of neighborhoods. One can only speculate how much stronger the effects of this early intervention would have been if the program had continued beyond the child's second year of life, or if the efforts had been made to engage a wider social setting in which the family lived. And that is the essence. What we do with home visitation is the beginning, not the end. We want to build strong programs, we want to sustain them, but if we don't build stronger soil in which that plant can have deeper roots, I think we're not going to be as pleased with our outcomes as we think we might be. Thank you.
Thank you very much, Deborah. It was a very engaging presentation, and I really liked the soil, the plant and soil garden. As someone who often kills plants,